Welcome to the Sisters in Loss podcast, a faith-based podcast that spotlights Black women that replace silence with storytelling around pregnancy and infant loss and infertility. Black women experience miscarriage and stillbirth 4 to 5 times more likely than white women in the United States, according to the CDC and NIH. Whether you've experienced a miscarriage, infant loss, or stillbirth, are trying to conceive, or have an infertility diagnosis, you will learn about resources and strategies to heal, gain clarity, peace, and hope, and find an empowering path forward after loss. I'm your host, Erica M. Freeman, and you'll hear me interview other sisters in loss from around the world who have healed from such a painful and traumatic experience by sharing their testimonies and stories to inspire and help others turn their pain into their purpose. Storytelling is powerful. Storytelling is activism. Storytelling is healing. Now let's get started. Hello, welcome to the podcast.
Thank you for having me.
Absolutely. So I like to begin with you sharing a little bit about yourself and what you do.
Sure. So I am Dr. Eboni January. I am a board certified OBGYN by trade. I've taken a little bit of a different path over the last several years where I do a lot of advocacy work, education work, both of not just providers, but also patients. I'm also an author of Empowered Motherhood, my latest book that I released in response to my patients and also in response to the maternal health crisis. So I have a business, Dr. EJ, and essentially we do healthcare consultancy, work with community-based organizations, insurance carriers, hospitals to make sure that we improve outcomes through education. And so that's a little bit about myself and what I do. I'm based in St. Louis, but I move around obviously for my educational tools and also book my book tour. So I do a lot, and that's
Yes,
who.
you do. Yes, you do. As we do, as we all do.
Oh,
We all are like playing many roles
yes.
in our professional lives, but also our personal lives. So I would love for you to talk about just your own personal journey to not only becoming a doctor, obviously becoming an OBGYN, but how that shaped your role in your interaction with your patients throughout their own motherhood journey.
Sure. So I decided that I wanted to be an OBGYN when I was 14, actually. So very, very early. At first, I would say 11, 12. I grew up in the Cosby Show era. So at first it was like I want to be an attorney, right? But then, then I saw that it was an OBGYN. And so that's what actually shed light on what an actual OBGYN was. But I'll say in my personal life, what really solidified it for me was that my grandmother had 14 children. And when I was 14, my stepmom became pregnant with my youngest sister. And so to watch her body change and this human being now that's here all of a sudden, that truly fascinated me. That was partly what it was at age 14. But at the same time, my grandmother, who had given life to all of these human beings, I watched her health deteriorate. And I watched my aunts take care of her and my dad provide the resources so that she can be taken care of. Um, while all of that's going on, my dad, who was all-American, he played football, basketball, ran track, the whole nine, he was really, really, really into wellness. He juiced every single day. We woke up to the juicer. So people are shocked when they find out that I don't drink soda or I don't drink a lot of juices. And it's because that was just how I grew up. So when you compile all of those things together, watching my grandmother struggle and then my aunt subsequently struggle with their weight and diabetes, high blood pressure, and then my stepmom to watch her body change, all of that really was a culmination of who I am and how I became, in addition to my father being into health and wellness. And so I said, I want to deliver babies, not just because of it's such a beautiful process, but also I'm able to help women from a primary care standpoint. So treating blood pressure, treating diabetes, and then also we have gynecological issues that, men don't have. And so it was like, if you have ADHD, this is like the best place for you if you want to be a doctor because you do so much. We're in the surgical field. So I'm a surgeon, so we don't just do C-sections, but we do gynecological surgeries. We do procedures in the office. So it's just so many things. It's such a rewarding career, and we're able to help bring life into this world. So that was my journey specifically on deciding who I would become, but also the type of doctor I would become, because I wanted to be the kind of doctor who helped to prevent disease, right? Not just treat it. And I knew if my dad's had multiple strokes, and we'll get into that, so he can't speak right now, but um, he could tell you any combination of fruits and vegetables that healed any particular ailment. And so we had a garden growing up, and considering where I grew up, it's like for you to have a garden where we grew up or you to even juice is like unheard of. So he really shaped the type of doctor that I would be from a preventative health standpoint, and to be very, very passionate, because there was so much passion in our household surrounding wellness and working out and jumping rope. And so those are the things that I help my patients with in the office, is not just from an educational standpoint. I want to make sure that you're educated and know that this is a team sport, right? But I also want to show you some preventable things that you can do in your everyday life to heal yourself, but also just prevent disease in general. So that's essentially how I became an OBGYN, and also the type of OBGYN that you see today.
Which I love. And I'm pretty sure you go a lot more into this in your journey in your book as well. The holistic and preventative measure thing is something that I see is a gap when it comes to our overall reproductive health. But
Mhm.
for sure, when it comes to Black women's health issues or reproductive challenges, that particularly are more higher for Black women, and leads to us having, miscarriages, babies that are born premature, to, now us, possibly dying. We don't really talk a lot about the preventative things that we could do holistically. So I would love for you to share, particularly around, you said you talked a lot about juicing and wellness, and I think as our population has aged, for us Cosby Show babies who did grow up on this, as we've aged, we are starting to get into more wellness, especially if we've already gone through our own journey to motherhood, and it has not gone the way that we thought it would. We know now, okay, well, we need to take a pause. Let's actually look at what we're eating. Let's
Mhm.
actually make sure that we're working out consistently. Let's actually, do some of those holistic things. So I would love for you to really talk about some of the things that we should be doing off jump before we even think about getting pregnant,
Yes.
to ensure that our bodies, our vessels, this image that we have is right and ready for carrying life.
Yes. And I think that that's a great question. Remember, the foundation of who I am is all about prevention and being proactive. And just to backtrack back to my aunts, um, I tell people when I go to speak, I tell people that about my grandmother when they ask me the same very question. And I say to them, my aunts ate the same food that killed my grandmother. And I call it funeral food, right? And it's something that in our environment is something of, in our culture where we just eat what we were taught to eat, right? And there's no one at blame, right? We know, I don't want to go into a history lesson, but we know we were given what was left over, and that is what became tradition for us. That's what came. And then let's not talk about people living in food deserts, right? And then we live in a generation where, sure, we've made it out of poor circumstances. And so now we can raise our children to make better choices as it pertains to what they eat, what they drink, et cetera, in their choices, right? So it's a whole combination of things to how we arrived at the point that we've arrived at. But now that we know, let's make sure that we make the necessary changes, right? You want to make sure that you're proactive in your approach to your health, even before you consider getting pregnant or just in general, because sometimes we're not thinking about having a baby. Many of the pregnancies are unplanned. So we have to just stick to a healthy diet no matter what. And I'm not saying that you should be eating healthy that you can't reward yourself, not necessarily reward yourself. Let me not say that because we have to change our mindset around food, but not saying that you can't have dibble and dabble here and there, but 80% of the time we need to be eating a pretty clean diet. Avocados, these healthy fats, those are some things that you want to make sure that you introduce into your diet if you are of reproductive age. Things like nuts, seeds, these support egg quality and even hormone production. So you want to make sure you consider those things, and even some fishes, right? The right, not the tilapias, eggs as well, and then chickens that are hormone free because we know that a lot of these foods have hormones in them and they're killing us. Complex carbs, not the white potatoes. We want sweet potatoes, even red potatoes are okay, quinoa, brown rice, even things like, from a protein standpoint, lentils. All of these things help to support insulin and regular cycles because when you talk about infertility, a lot of women have undiagnosed PCOS, polycystic ovarian syndrome, and this is an insulin resistant situation, right? And then we can talk about later in pregnancy what this can lead up to. And then you also green leafy vegetables. I tell women if I draw a picture of a plate, and I would do this in the office all the time. I take the white paper that we put over the exam table, and I draw pictures for my patients. And I draw a picture of a circle that would emulate a plate. I draw it and draw a straight line, cut it in half, and one half should be green leafy vegetables, spinach, kale, collards. These are high in folate, right? And I want, if you're watching, to take notes. Folic acid or folate for early pregnancy, pre-pregnancy helps with baby's brain development, and that is key. That is critical. And you can also take a prenatal vitamin before you get pregnant. You can just take it daily. Prenatal vitamins are really good for just anyone. And then berries, 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 berries. Okay, eat seeds to grow seeds. I tell people like many fruits are high in sugar, right? And not necessarily the bad sugar. I'd rather you have, an apple versus a cupcake any day. But if it has a berry at the end of it, eat it, right? Strawberries, blueberries, raspberries, these have antioxidants that help protect eggs.
Love it. Love it. And all of those things are good. I am somebody, especially this time of year, that I cook a big pot of greens every weekend.
Oh no. Well, let's pause there, right? You can make some healthy choices with these
You
greens.
do.
I make my healthy version of greens,
I
right?
do as well.
They're still leafy.
They're
So
still good.
put
I don't use
turmeric in
meat.
everything.
Yes.
You can put turmeric in everything. You can put a sea salt in it. That
hmm
will help. You can put, as opposed to the pork, you can put the turkey in it to add flavor. So there are some ways that I teach women how to kind of trick the brain into a healthier version of that bad food that you like to eat.
Yes, absolutely, which is so good. So let's switch gears and talk about loss. Obviously, a lot of the listeners who listen to this podcast have had some form of perinatal loss, whether
Mhm.
it's a miscarriage all the way through stillbirth and SIDS and even infant loss.
Yeah.
A lot of the ladies who come on the podcast always are not necessarily going back and forth in their mind about changing providers, particularly, but also just in general, like, you know, can I trust the provider that I had? What questions should I ask my provider when I am trying to gear up to have the courage to try again? Because I think it's a courage, it's a trust in not only themselves, their bodies, their care team, their partners. Like it's a whole trust thing.
Sure.
But also just the grief of physically going back into the doctor's office that you were pregnant at. And then
Mhm.
now I'm not pregnant, but I'm seeing all these other pregnant women, and I have to face this another level of grief that I have not actually done to get the help that I need because I do want a baby, right? I do want the thing on the other side. So I would love for you to just share from a provider's perspective, things that we should be looking out for, questions that we should ask, And how do we make sure that we are building the right team around us that we can trust?
Sure. So let me say this to you. Grief and hope can exist in one person. Okay. We're very multidimensional. So when you say women that walk into the office and they see other pregnant women, because just because you had a loss or a stillbirth or what have you, that doesn't mean that you can't have a nice healthy baby in the future. It's okay to grieve, but it's also okay to have hope. Okay. So I want to be clear about that. And also just to back up to your statement where you talked about maybe switching providers and the reason being we have to ask, and I want people to take notes on this. What caused the loss is a very important question to ask. A loss doesn't necessarily mean that someone did something wrong. Okay. And I see a lot of miscarriages in the ER a ton, and they're typically early on. So before babies even form, properly. And typically that is the cause, right? Is that the baby wasn't formed properly. Going back to the previous statement where I talked about folic acid, this is important for that reason. So, an early pregnancy loss specifically doesn't mean that anyone on the team, and you're part of the team, women, men, you're part of the team as well. It doesn't mean that someone did something wrong. It doesn't mean that you have to switch providers. Okay. So I want to be clear about that. Now, if you want someone who's a little bit more empathetic, then, sure, switch providers. But a loss doesn't necessarily mean that you need to go switch providers. Okay. Because early pregnancy losses could be many times are signs of chromosomal issues that the baby didn't form properly. And if you go on to have a baby, then maybe he or she may struggle with some type of chromosomal abnormality. Okay, so I want to be clear about that. Then you have late, like let's say second trimester losses, and I'm just talking specifically about pregnancy. Sometimes that it could be anything. It could be just an incident. Maybe someone got into an accident. It was a placental issue where the placenta pooped out. It separated improperly. There's so many causes to loss within the pregnancy itself. Then you get later in pregnancy where someone comes in with a stillbirth, right? Many times it could be a maternal medical issue that caused a stillbirth. Okay. Like for example, gestational diabetes. And so it's funny, I made a post about weight gain in pregnancy. And a person commented that it said that they had gained X amount of weight in a short period of time. And I'm like, whoa, it was a red flag for me. And I asked two questions. What are you eating? And what is your blood pressure? Right. And these were because then I could guide them in the right direction. So sometimes pregnancy gives women free reign to eat whatever. Right. But what happens though is it increases your risk if you're eating the wrong combinations of food, increases your risk of gestational diabetes. And then people with gestational diabetes can go on to develop type 2 diabetes. 50% can go on to develop type 2 diabetes after they deliver. So stillbirth is can be caused by gestational diabetes or a maternal health issue, not that someone did something wrong. Okay. The doctor doesn't live inside of your body, but it's important to ask questions, to communicate. What is the blood pressure looking? How's my blood pressure, doc? Know your normal blood pressure because I can be like, I run low. I work out every single day. My blood pressure is 112 over 60 sometimes, right? And I'm 5'9" and I'm not, a super slim girl. I'm, pretty muscular. So, and I still have a lower blood pressure, which is we commonly see in thinner women, more petite women. So ask what your blood pressure is. Keep track of your trends, right? Keep track of baby's movement. That's very important. And articulate these things. If something feels off, go in, right? Don't second guess yourself. I often see sometimes stillbirth when sometimes people wait too long to go in, where they think things are just okay. Know what kick counts are. Talk to your provider about those things. Make sure that you are educated. The reason I wrote my book was because I saw so many women who were not educated as it pertains to pregnancy. Okay. And we need you. I tell my patients all the time, you are a part of the team. I need you to report to me. Okay. So that is so important. And that's one of the reasons, as I stated before, that I wrote my book because I'm licensed in 16 states. I've delivered over 8,000 babies and I've seen a lot. And so, which means that I've taken care of way more than 8,000 patients. So, I see many people are uneducated or they're afraid to ask a question because they don't know what to ask or they don't know the terminology. And so that's why I took it upon myself to educate women so that they know they don't feel like embarrassed when they ask their doctor questions. So now you're part of the team. Like I went and did my homework. Oh, I know what preeclampsia is, doc. What are my risks, right? Ask what the risks are. What are my risks of gestational diabetes? Can you check my hemoglobin A1C? And before you get pregnant, ladies, make sure your hemoglobin A1C is checked, right? That's the check for diabetes because that can increase your risk of stillbirth, things of that nature, right? So, which increases your risk of loss. Right. So I think that that's important to set yourself up for success by educating yourself, knowing what terms the doctors are using. If a doctor uses a term that you don't understand, you ask a question and ask them to print out information on that so you can go and do your homework as well. So loss sometimes has different, reasons for loss, whether a person may have a clotting disorder, right? That's another thing. Sometimes we find out after the fact that we do lab testing and find out that someone has a clotting disorder that increased their risk of stillbirth. So all of these things play a role. It is not necessarily that you as a patient did something wrong or the doctor, nurse practitioner, or midwife that they did something wrong. Sometimes it's genetics. Sometimes it is okay. There was a critical time period where I should have said, okay, my blood pressure was this, doc, or my baby wasn't moving, doc. We don't always know what's going on with you because we see you every 4 weeks until you're 28 weeks, and then every 2 weeks until you're 36 weeks, and then every week after that. So there are periods where we go without seeing you, okay, unless you have some type of complication, and then we may co-manage your condition with the MFM, which is the maternal fetal medicine doctor or the high risk doctor. So when you talk about loss, we want to make sure that you ask what caused the loss, right? Can you do the lab testing for me? And if they're not, go to someone else. Okay. You talk about we before we got on you like, okay, maybe people don't know that they have other options because of their insurance. No, they're not the only provider that accepts that insurance. Okay. So just know if you feel uncomfortable, if they haven't done their due diligence and you feel the need to go to another provider, then you have options, okay? So I want to be clear about that. And then also with regards to loss, I want to make sure that women and men and the children, if you have older children, that you understand that it's not your fault. It's absolutely not your fault. And you should make sure that you understand that you can go on to have a nice, healthy pregnancy. Okay. Just make sure that, we're doing the right testing, genetic testing, just checking you for any type of conditions as well, because I've seen that happen where women will have underlying health conditions that no one knows about. Like it's one thing for you to come in and I know that you have high blood pressure, or I know that you have diabetes, or I know that you have lupus, but it's another thing for you to be in your late 30s, early 40s, and you haven't been diagnosed with anything because maybe you didn't go to the doctor, or it's just a condition that no one checked for because you didn't have any symptoms. And then we find out something after the fact. And I've seen that as well.
So let's stay on that because I think now, I mean, obviously, there's been a ton of research out there too that has shown that a lot of our population is having birth or giving birth or wanting to get pregnant later in life. So you have a lot of folks who are 35 plus,
Yeah.
40 plus,
Yes.
45 plus who are now, have a stable partner and are ready or choosing to do it on their own because we have those too where they're ready to start the process of having kids. So I would love for you to, um, maybe, uh, remove the myth around people having kids over 35 and, all of the geriatric naming around that. Obviously, there is some truth to it based on some research, which we know. But I want you to give my listeners some reassurance, especially if they are older, trying to get pregnant, trying to stay pregnant. They may have experienced a loss, that they know that they can still continue on this journey with all the support that you just said, with the OBGYN that's listening to them, that's they're getting all their numbers, maybe with the MFM, depending on what other underlying condition that they have. I just want to get rid of that myth because I think
Yeah.
people can have children over 35. So I want
Oh,
you to agree with me or just disable the myth for me.
honey, I've delivered 51-year-olds. Okay.
Yes.
So so we can absolutely have babies later in life. Now, is it without risk? No. Okay. But I do want to be clear that ladies, if you're in your late 30s or early 30s, I'll say this, try and freeze your eggs. Okay. If make sure you freeze your eggs. However, going back to, let's say you are attempting pregnancy later in life, you're not without hope. I had a lady that I saw years ago. She people gave her she DM'd me, or actually she sent me a message on LinkedIn. This actually just happened 2 weeks ago. She said, Dr. January, I just want you to know that you were the only person that listened to me when I was really, really trying to achieve a pregnancy, and she had done everything. Now she has a 4-year-old, and I couldn't believe it. She found me on LinkedIn, and I ran tests on her, and I told her, okay, I could send her to a few people, and I'm like, no, you can have a baby. And now she has a 4-year-old, and that's super exciting. And so I want to make sure that you know that if you are older, you can have a baby. It's not without risk, right? So you still want to take prenatal vitamins. I would encourage these individuals to take prenatal vitamins and have a healthier diet, more healthy than someone who's younger. In addition to that, all of those things that I stated to eat, make sure you're eating those, prepping yourself. In order to grow seeds, you have to eat seeds. Remember that, especially if you're older in age. But also, if you now at this age where you have a chronic medical condition, you've been diagnosed with something, make sure that your health is optimized. So let's say you have depression or anxiety, make sure they have you down maybe to one medication that has maximized what you maximize your condition, right? That is improved. So many times we'll go on two medications to manage one condition. If possible, try to have them stabilize you on one medication to decrease any risk to baby, right? Especially as you age. Two, if you have high blood pressure, because now you're up in age and now been diagnosed with high blood pressure, you want to make sure that they have you on a blood pressure medicine, if possible, to have you on a blood pressure medicine that is not harmful to an early pregnancy. Okay. And so you want to make sure you do your part as well. So, and I'm not one of those people that say no one needs medication, but some people do need medication, but you want to do your part with regards to what you do outside of medication, trying to get off of those medications, whether it's dropping weight. As we age, the hormones, we get to picking up a little bit of weight, comes off a little harder. And so you want to make sure that is the case as well, that I've made sure that I'm the healthiest version of me, that I'm putting the right things into my body. But you can absolutely have, unless you have some type of diagnosed issue with your ovaries or something like that, then you can have babies. And then I just want to throw out this key thing, which we're not talking about, but I do want to dispel this myth. If you have fibroids, you can't have a baby. You can get pregnant, right? I do want to comment on that. And then that's a whole nother educational piece, because there are some issues that you could have with fibroids, but we deliver people all the time who have fibroids. So they don't necessarily stop you from getting pregnant. So I want to dispel that myth as well.
Yes, thank you for dispelling that myth because a lot of folks who share their stories on this podcast and probably are listening probably have fibroids or have not been diagnosed properly with fibroids. And the first question that you gave us hits that. Like, did we really ask what happened to our loss? Have they done all of that comprehensive blood work and ultrasounds on our reproductive system to see is there anything there that could have led to losses or subsequent losses that we have? And yes, no, all of this is good. Very, very good. So I want to talk about your book. What else is in your book um that really talks to this maternal health crisis? I think we really talk about Black maternal health as a whole, where we
Mhm.
see those images of um, fathers or partners without the moms. We really don't a lot. We don't talk about a lot the infant side of it. So these moms who don't have babies, but it all fits under the same umbrella. We all are we all are
Yeah.
in this same crisis of either babies are dying or mothers are dying in our systems. I would love for you to share just your own experience, especially in the work that you do, but also highlighting some of the stories that you've told in your book.
Yeah. So I want to make sure that we talk a lot about the maternal health crisis because it is so unfortunate and um, it's sad because I saw these things coming, right? I've been practicing since 2014. And one of the things that my patients would say to me, because I'll tell you this, I tell my patients, you all are my family because I see you all more than my actual family, right? And so I was just locked in with my patients, and they told me no one is educating us. No one is educating us the way that you are. Like no one is doing this. Like I wish I've had you years ago. And then they're in my DM. Oh, where are you? I need to find you. I want to come back to you. I want to have a baby, but I won't have a baby because you're not my doctor. You're not here anymore. So education is key, right? We talk about advocacy, and I am an advocate, but I believe in advocating from a place of education. You understand? So a lot of fear can be alleviated when we have knowledge. And I don't want to sound cliche, but knowledge is power. And so my book was really what my patients told me, right, that I needed to do indirectly, which is that we need education, we need a blueprint, we need some type of knowledge so that I know what questions to ask this other doctor or this doctor or what have you, so I can be an integral part of the team. And so my book breaks down every aspect of pregnancy, pre-pregnancy, what to eat, resources if you're struggling with mental health conditions, or just if you need an outlet, journaling, things of that. I break everything down. I break down pregnancy complications. You know about preeclampsia. You know the difference between preeclampsia and gestational hypertension. You know the difference. I teach you the difference between postpartum psychosis and postpartum blues and postpartum depression. I teach those things. I provide resources inside of the book. I break down what is a VBAC, vaginal birth after cesarean. Are you a candidate or are you not a candidate? Because, people will come in because I'll see patients after another doctor and they want to bash the doctor, but I would have to explain to them where you weren't necessarily a candidate, and maybe that doctor didn't relay this to you because they were in a rush, or maybe they just didn't think that it was important to let you know. I don't know, right? I'm not in every doctor's visit, so I wouldn't know, but I wanted to make sure that I put things inside of my book that were frequently asked or things that people should have asked me about common conditions, and then labor, right? What's a first degree tear? What's a second degree tear? And then the postpartum period. So everything I walk you through, it's really a resource guide for you to have an intelligent conversation with your doctor. It is not the Bible. It is not the end all be all. You still need to talk to your doctor. I'm not I don't know your health history or anything like that, but I wanted to give you something that you can utilize so that things don't go over your head in the doctor's office. And when you are empowered from a place of knowledge, it makes you very, very, very integral to the team. And so, and this is my book isn't just for women, it's for men. You talked about that. Men, we need you all to pay attention to signs of postpartum preeclampsia, postpartum depression, because these are top killers in the postpartum period. So we need you to be our eyes and ears because once again, it's just a 6 week visit. And the postpartum period lasts a little bit longer than that. So we see you for a 6 week visit, but we need you all to pay attention and to be in doulas. Like I'm super, super pro doula. And I tell doulas like you also should have a little bit of clinical knowledge as well so that you can understand what the woman is going through so that you can call us and say, hey, I think she needs to be seen for this, or think she needs to go. These are her signs. These are her blood pressures. She delivered, a week ago, and this is what's happening. She's having spots in her vision. So I break down the signs and symptoms so that you can be able to identify things so that you can call us, right? Because many times these deaths are happening in the postpartum period, and we're not seeing you, and so they're not necessarily always in the hospital. They're in the postpartum period. So I need you. I need the doulas. I need the dads. I need the friends to educate and spend a little bit of the baby shower gift money on educational tools, right? And even if it means providing your loved one going in and maybe giving her some type of gift card for a doula or a gift card for a book. So I think that that's very, very important. And so my book was really dedicated to patients that I've seen over the years needing help, but it also was something that I saw in the maternal health crisis where we need you all to be eyes and ears for us as well.
Hmm.
Then on the flip side of things, I go into hospitals and educate doctors on delivering culturally competent care because you can
Oh,
be
I love
biased
that.
and not know it.
Yeah,
Okay. So that's killing folks as well.
it
So it's
sure
not just
is.
about a knowledge thing, it's also from, so I advocate with solutions.
Hmm.
We talk about it, and that's great. Awareness is key, right? Because now we're exposing a lot of things, and that is a battle, but it also helps. But also, I also wanted to help with solutions, and that means educational tools that can make you a powerful part of the team, and also from a doctor standpoint, making sure that doctors understand that you may be biased and you not know that you're biased. Okay, but some people do know that they're biased, and this is, that's a whole nother conversation. But I do go into hospitals and I teach and train on bias, culturally competent care, and then culturally and linguistically appropriate services because the U.S. is very diverse, and
Yes.
that's what I do from that standpoint.
Absolutely. As a doula, that is amazing because, like you said, education is so key, and a lot of our patients, a lot of clients may not know because they just don't know. This is their first pregnancy. This is their first pregnancy, like full pregnancy after, especially if they've gone through a miscarriage or some type of loss before, and they're just nervous. They're just anxious. They're just not, trying to really understand themselves, their bodies before they get to that point of delivery and what that whole time period is. But I always tell people, I always tell my clients, this is the easy part. Postpartum is when you need
That
me.
labor, let me tell you, honey, I'm like
Postpartum is when
like
you need me.
And
And
then
that is
I tell
actually,
people,
yeah.
yeah, you need to start building your village and your
Hmm.
team for that postpartum period. Plan for postpartum the way you plan for these baby showers and these
100%.
reveals. And I tell this, on interviews all the time that my best friend just had a baby. She's 6 months. She's such a cutie. And she's my goddaughter. I didn't
Hmm.
buy her a thing for the baby
I,
shower.
I wouldn't either.
I didn't buy her a thing. And you know what I did for her? I sent her catering every
Every
week for 6 weeks.
See, exactly. That's exactly what people need in postpartum.
That's what I sent her. So I want to be clear. And also, I don't want to leave out, you mentioned first time moms who don't know
Hmm.
certain things. I don't want to leave out moms who have been moms and still don't know because
Oh,
let's say
true, true. Hmm.
you had a baby in your 20s and you're super healthy, didn't have preeclampsia or any signs or any issues with your blood pressure. So you didn't deal with that either. So you're just like a first time or someone who's a first time mom who has a complication, right? And now you or a baby, let's talk about that. I've had three babies,
Hmm.
just had another baby, and I got a complication. So I have
Hmm.
three babies at home that I got to deal with. And I, I don't want to come into the doctor because I got to deal with my other babies. And I see that a lot.
That is true. The other stressors in
Elevated,
life.
they have a
Hmm.
elevated blood pressure. They don't want to come in for a preeclampsia treatment because they got so much to do at home. And that is killing people.
That is
So
exactly
let's
what's
so
killing
let's
people.
talk about it's a team approach because we all make mistakes. We all, have things that we could have done differently. But I see women that if someone didn't force them to come in, or if I didn't stop their discharge because their blood pressure and they wanted to beg me, I gotta go home and do whatever. And I said, no, this blood pressure is too ridiculous. I'm not sending you home. And they would fight because they have three other babies at home that they need to get to. But I said, you won't be around for these three babies if I don't keep you. So don't be afraid I don't want to leave out moms who've had babies for the first time or
Hmm.
who have had multiple babies in the past. I don't want to leave them out either because
Hmm.
they experience loss and they experience complications as well. And
They
you
do.
and you must know that when they had babies in, maybe late teens, early 20s, they didn't have complications and now they do. So they think that this pregnancy is going to be like the last pregnancy, and that's not the case. Your body changes over the
Every
years. You have
pregnancy is
high blood
different.
pressure before,
Hmm.
right? So I want to be sure that I let people know that.
So I would like to end on this. I think sisterhood and community is extremely important, and it's kind of what we were just talking about. So I would love for you to share how sisterhood and community has supported you on this journey.
So sisterhood has, I'm going to tell you that I'm grieving right now the loss of my mom and my aunt
Mm,
and my nephew. Um, and I lost them in like, and my grandmother, I lost them very, very close together within like a year, and then my grandmother within a few years. And I take care of a sick father.
mm,
Community has really, and sisterhood, when I tell you how many people have reached out to me on social media, asking about my dad, asking me how I'm doing, from a grief standpoint, is there anything that I need? And my friends who have become my family, when I tell you I couldn't be here, I could not have even written this book to help other people if my friends didn't step up and step in with the care of my dad. I have friends who changed my dad's diapers. Friends who sat with him while I slept because I needed to sleep. Friends who brought me food. And so when you talk about the importance of sisterhood, especially in a day and age where people are so vicious on social media, right? And they just say whatever because they got a keyboard and they don't, but when the shoe is on the other foot, they don't necessarily give, they want the same grace that they didn't give. And so I will say that I've had such an amazing support system, not just from my friends, but from like patients who followed me on social media and who have supported me. And so sisterhood is one of the most important things that you can have. And also men who support, right? Because I don't want to leave them out as well because there's a common myth that men don't support. They do.
they do.
They do. And they experience loss as well.
Hmm. They
So we,
do,
we have
which
to
is a
check
whole nother side, yeah, of
all the
grieving
side.
in
A whole
general,
nother
right?
side. Yeah.
Absolutely. No, thank you for sharing that. As a caregiver, my son has cerebral palsy, so as a caregiver, I feel you on that, especially as we are grieving so many different things. Sisterhood is a bomb. Community support is necessary,
Yeah.
and I'm so happy that we had this conversation. Leave your socials with us. Where can we follow you? Where can we purchase the book? Give us all the deets.
Thank you. So you can follow me on Instagram. It's Dr. Ebony January, doctor spelled out, Ebony with an I, January just like the month. Facebook is Dr. Ebony January. You can purchase the book on Amazon.com. It's Empowered Motherhood. And you can also go to my website, drej.com, and that's doctor spelled out. And if you have any questions, you can also email me at drej@drej.com, and that's doctor spelled out on both sides.
I love it. Thank you so much, Dr. EJ, for being on the podcast and sharing a little bit about your story and definitely about your book, and then really educating us because obviously we all need to refresh,
Yeah,
especially to start the new year, end the year, all the things.
we do. We do. And thank you for having me.
Absolutely. Thank you for listening to today's episode. For show notes, go to sistersinloss.com to stay connected with us and join the Sisters in Loss community and receive my weekly newsletter. Please go to sistersinloss.com/newsletter. That is sistersinloss.com/newsletter. Please rate and review this episode, and I will talk to you next week.